I'm back again, and today we're going to talk about how to increase dopamine doing keto. What is dopamine? It's a neurotransmitter. Neurotransmitter is very similar to a hormone, but instead of traveling through the blood, it travels through the nervous system, okay? So it transmits communication. Dopamine is produced with various parts of the brain, one specific part called the nucleus accumbens, okay? So it's deep inside the brain. And it's involved, they don't know exactly what it does, but it's involved with motivation, drive, and reward. Okay, so they found that if they destroy this structure, you lose your motivation, your drive, and the reward system is affected. And what I'm talking about with reward system, I'm talking about like the pleasure centers of the body. You see a lot of problems with this nucleus in the brain with drug addiction, and people that are addicted to carbohydrates. So what happens when people take drugs, for example, is it triggers this little nucleus in the brain, this little center, this nerve bundle, which then increases dopamine. It makes them feel better, right? And then, so it comes up and it comes down. And now they started getting withdrawals, so they need it again. And so they do it again, and they do it again. Every time they do it, it creates more of a dysfunction. And you need more and more drug to create the same effect. So dopamine is involved with these basic drives, okay? Let's say you have a certain appetite for a donut, for example, and you see this incredible chocolate donut, and you're envisioning it has a certain texture to it, a certain taste, a certain feeling it will give you, this great pleasure, and then you start consuming it, and then you get this wonderful feeling for about a minute, and then it drops down, right? The more you start consuming it, the less pleasure you get over a period of time, to the point where that pleasure eventually starts turning into no pleasure, and then eventually pain, because you have all these side effects from the sugar. But over time, when you lose the function of this little nucleus and you start developing dopamine deficiencies, you lack that get up and go mojo, okay? You become apathetic. Apathy is right down there with depression. You don't care anymore. People that are depressed, they're just not motivated. They don't have the drive. They don't have pleasure. All right, so now let's circle back to keto. What does keto do with dopamine? Keto helps you normalize insulin, okay? It lowers insulin. Now, what's the connection between insulin and dopamine? Insulin has a huge role in regulating dopamine. This is why people initially like the carbohydrates, because they feel so much pleasure from it, because it stimulates dopamine at first, okay? But the more you do it chronically, you start developing insulin resistance. So that means that insulin is unavailable to you. So there's a lot of different receptors for insulin in the brain. So the more you try to elevate insulin over and over and over by doing the carbs, for example, you're going to create a lowered amount of dopamine. So from a food angle, if you have a history of consuming a lot of carbohydrates, chances are your dopamine might be pretty low because you have insulin resistance. So going on keto drops the carbs, you start healing insulin resistance, and you start reestablishing your dopamine centers. So a lot of times people will take a drug for depression. They'll take a drug that recycles serotonin. Okay, that's a different neurotransmitter. And many times it just doesn't help people. So I did a video on this recently where I talked about a lot of the research that's done, especially with psychiatric drugs. What they do is they only include the ones that are positive and don't include the negative ones, the ones that either have complications or don't work. So you're really getting an alteration of the facts of what these medications really do and the effectiveness, and as well as the safety as well. It's not exactly what they publish because they're not putting in all the data. They put in only what they want you to see. And of course, if it doesn't work, the person's labeled as treatment-resistant depression. Okay, it sounds very scientific. And of course, they'll give you new medications for that or electric shock therapy. Now, as a side note, what's interesting about that is that my attorney, Jonathan Emord, this attorney has won more cases against the FDA than any other attorney. So right now, he's involved in a huge battle with the FDA and electric shock therapy in trying to change the classification of ECT. Now, what's interesting is the FDA has never received not one single clinical trial from the manufacturing companies that make electroshock devices. which show that they're safe or effective. So hopefully you'll be very successful in handling that, because to shock someone's brain with all this voltage, when really you can just fix this right here with that, completely unnecessary. So dopamine is involved with addictions, it's involved in depression, it's involved with insulin resistance. Also, there's other causes of depression. One is chronically fatigued. If you're completely exhausted because you're not sleeping or some other reason, you're going to be depressed. It's very difficult to be depressed when you have tons of vitality and health and energy. Okay, number two, when you have blood sugar problems, when your blood sugar drops, and let's say you're not on keto, you can develop anxiety, you can develop depression. Why? Because your brain gets first dibs on glucose, okay? So if you don't have enough glucose to the brain, it suffers, and you start having all sorts of problems with dopamine and other neurotransmitters. And again, just to summarize, low dopamine will create depression as well. So if you're new to my channel and you don't know much about it, click the link down below and really learn how to do keto the healthy way. Thanks for watching. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr.Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.